Oh,
Hi, good afternoon, everyone. Welcome to the webinar. I'm Sandra Whitehead, and I am an associate professor here at George Washington University in beautiful Washington, D.C. And I am also have the privilege of being the current president of SOPHIA. Let's see. I forgot I was sharing the slides, sorry. As you can see, SOPHIA, who is co-sponsor of this webinar, is a community of health and all policies professionals. We create resources, we host webinars, and we have work groups to form work products that are useful to practitioners of health and all policies, of which health impact assessment is one tool. I'm also the chair of the urban planning department at George Washington University, which hosts a master's program. So let's get started. And I'm supposed to fulfill my responsibility to tell you about SOPHIA and encourage you to join. If you like this webinar, we do also internal webinars that are just for members. So hopefully you would like to join us and be a part of our community. So I'd like to get a bead on kind of what is your familiarity with HIA? Have you done an HIA? Are you aware of it? Have you participated in one? If you could write that in the chat for me so that I can get kind of a feel for the audience. Hmm. Uh, hey, Anna, I see your comments. Hi, Lindsay. Good to see you. Hey, Trish. All right, so most people know about HIA or have even done HIAs. This is great. And then we have a couple people who are just kind of familiar but never done it. This is awesome. Okay, so we have this wide range of people. What about cumulative impact assessment? There's been a lot more talk about cumulative impact assessment in the last 2 years than probably over a while, right? Like it would come out, we would work on it, and then it would kind of go back on the wayside because people would say it was too expensive, it was too hard, there's not a standard method. Um, has anyone participated in a cumulative impact assessment or had a training on it? I see Trish, because you're part of the EPA experience, which is great. Hey, Margaret, thank you. So great. So we are going to talk about cumulative impact assessment and HIA as kind of a set of processes. And what I mean by that is, you know, why do we have, why do we need to have these processes, right? What we're looking at in HIA is the kind of the health impacts of a particular impacted community that we can scientifically define, and what is the impact of a program, policy, or process on this community that is proposed, not after the fact, not but before the policy is implemented. And then how could we make recommendations to mitigate the poor impacts and as much as possible, and to emphasize any positive impacts. But what we find and I'm going to use this in a regulatory context. So what we find in the United States in our regulatory context is that there's a lot of permitting agencies, right? It's very fragmented, whether it's, an environmental agency, which would be the EPA, or the state version of the EPA, or your local permitting office at your city or county, right? There's a reliance in a building of those regulations on each other, but it's not always clear to the customer or to the impacted community who the permitting uh, regulatory agency is. We have a reliance now on tools that are really kind of technical that show show where communities have disproportionate burden or disparities, and kind of give us this idea of what is, I think, erroneously called an EJ community. I prefer to think of them as communities that are experiencing environmental injustice. Um, and then the agency's ability to really engage deeply with communities. They don't have enough people. They don't have enough people who are trained to do this. And I don't know that they have the manpower at all to do this in a deep and meaningful way on a long-term basis. Because if you're going to look at cumulative impacts, you really need to be embedded in the community and understand their context. And you need to build your trust with them. And then the failure to include, consider, and monitor health in excuse me, in regulatory situations. So the agencies need these tools to be able to make sure that the intent of the law is met, whereas communities who are impacted by decisions are participating in those decisions, giving input and feedback, and then co-creating solutions. There are several tools that we use really to look at these outcomes. And excuse me, my computer's doing something wonky. So there's mapping tools, there are health matrices, there's health notes analyses, which apply to legislative action, whether it's at the city or the state level. Those have been piloted. And there's HIA, and what I propose is HIA 2.0, the next evolution of HIA, Cumulative Impact Assessment. And all of these tools sit under a health and all policies framework, where you're really trying to change policy to improve health outcomes. So HIA really seeks to ensure that governmental decisions are considering health, whether that's in just understanding the health outcomes or changing policy, as I mentioned, to improve health outcomes. NEPA, which requires that health and impacts are looked at, right? And human health, it says, after environmental impacts and human health impacts. But those are rarely enforced. Sometimes they are, but it's very rare. I recently participated in a process in Tacoma, Washington, where the HIA was part of the environmental impact statement, and it was used. And HIAs are place-based, meaning that they're looking specifically at one community and the impacts there of one of the P4s. And as far as I know, only one HIA has used this cumulative impacts approach, and that's the Chicago General Iron permitting decision, in which this process was used to deny a permit for a recycling plant to be moved into a community that didn't want it, that didn't need it because they already had disparities. But to me, HIA and CIA are about putting people in the decision, right? In a risk assessment only context, we don't really, it's very empirically based. We're looking at just the facts, ma'am, right? And there's not enough opportunity for people's lived experience, the people who are being impacted, to be incorporated into the process. And frankly, different agencies are at different places in their ability to engage, whether it's that they are back at informing the community. If you think of the range of community engagement, the very first piece of that is informing communities, where you go and you tell them what you're going to do to them, right? And then there's engaging communities where they talk back at you, but you don't necessarily have to act on what they tell you, right? Where cumulative impact is, where HIA is in that sort of we listen to community lived experience, we think about it as evidence, and we kind of marry it with our empirical evidence, but that's as far as we go, right? A lot of times we're really rushed whenever we're writing the recommendations of an HIA, and our community engagement and feedback process isn't always as robust as it could be. In a CIA, your engagement model is at co-creation, right? Like they are involved at every step of the process. They're giving you feedback in your scoping and your screening. Screening, part of screening is that deep engagement, that trust building activity. Um, and so it's, to me, it's a deepening of your engagement. And that's one way where I think that CIA is the evolution, is in considering communities' thoughts, feelings, morals, and expectations, and co-creating with them. And the reason we want to use HIA as a basis for CIA, and I think that this is basically where the federal government is going, is using the phases of HIA to really dive deep into these other aspects of and making it CIA. So what they're really doing is they're taking the phases of HIA and they've redefined them and the activities so that it reflects this deeper engagement and this co-creation model. Right. So the other reason they want to use HIA is because it's very well established, right? There are minimum elements and practice standards. There's a community and an association in the United States. There is a worldwide community of practitioners of HIA, and it's frankly very useful and flexible tool. It's scalable at different piece. You can do it at different scales of community, you know, from neighborhood scale all the way up to a state or federal level. You can also use a short process, a medium process, or a long process in HIA. And it has this model already of valuing equity and considering disparities and understanding vulnerabilities in a differential way, instead of starting your modeling for health impacts with everyone's vulnerability being the same. So it's a natural fit for CIA. And it also already considers a broad range of determinants, right? If you think about your traditional risk model, they're just looking at the facts, right? And they're not sociologists, right? They're not paid to do sociology. So they're not necessarily looking at other kinds of stressors. And HIA incorporates environmental, social, and economic stressors, as well as health stressors, because those all impact our health, right? The social determinants model of health. So kind of doing the comparison to make my case, HIA looks at vulnerability, it looks at the magnitude and the severity of impacts based on differential vulnerability. It uses various forms of community engagement, and the only way that's usually limited is by staffing time and funding, honestly. And what kind of HIA you want to do, right? If you're doing a desktop, you don't necessarily need as much engagement. And then HIA, as I mentioned, has this very solid standard of practice. And then I see these the CIA pieces on the right-hand side of the screen as really, this is the deepening, right? This is the formalization of using lived experience. This is the formalization and the calling out of different kinds of stressors for the people in the community. And this is really quantifying those stressors. And if you can, and in most cases you can, I would say myself and my practice take it one step further and try to monetize those impacts, right? So if you're presenting this to a decision maker at an agency or local government, you want to make sure that you have quantified how much these negative impacts are going to cost, quantify how much the proposed mitigative uh, actions will cost, and show a net benefit to the community. Yes, in health, yes, in well-being, but those are harder to quantify. And in this environment, I think we need to be more conscious of quantifying and monetizing our results so that we can speak to the new people in power. CIA has really started to coalesce around some principles, and this is through my work with not just the EPA, but in reading all of the new assessments that are out, looking at the literature that's just blossomed. I think it's the number of articles on cumulative impact assessment has tripled in the last 36 months, which is kind of amazing. But looking at what those principles are, as I co-chaired the National Environmental Justice Advisory Council's work group on cumulative impacts, and these are some of the themes that we came out with, right? To base it on historical burden should not be a detriment. No community should suffer adverse effects, right, disproportionately, or public health consequences. All communities deserve and should be equally protected. And government regulatory agencies should consider the concentration of environmental stressors. So if there's already, 3 power plants near this community, and there's an application to the US EPA for a 4th power plant. The only thing that they can really consider in their view legally is that 1 power plant and its emissions, right? And what we're asking them to look at with cumulative impact assessment is the emissions and the vulnerabilities of the community that already exist before putting more there and polluting the air more and allowing, whatever their allowable, permitted, allowable uh, spewing is out of the stacks. So that community should not be overburdened just because they already have structural issues that have been visited on them. So these are some of the other principles, right? Like center communities, and make sure that you're looking at equity, acknowledge the limits of regulatory practice, and integrate cumulative impacts into regulatory decision making. And there's all kinds of discussion around how long the agencies have to review applications and their constraints and limitations. But one thing I will offer to you is that there are ways to use artificial intelligence at every step of this process that will make it faster, better, cheaper, and able to meet the deadlines of permitting agencies. The communities that we're talking about are already dealing with these kind of stressors, right? Racism, redlining, policy decisions that were made in the 20s and the 30s, zoning decisions that were made a couple of weeks ago, right? There are a concentration of polluting uses, which we've known, since Dr. Bullard wrote his first book. We have known that this happens, and still we're struggling with how to measure it and how to co-create solutions with communities to solve these issues. And these are the factors that you have to consider in cumulative impact assessment that you might touch on in HIA, but you wouldn't necessarily build that into your initial scoping process. So I mentioned that that HIA has a minimum elements and practice standards. And really, it makes points that we just updated it in 2022, but really it talks about the same principles of CIA, right, as an evolution of HIA. I think this is the fourth version of the minimum elements and practice standards, and we keep updating it as our understanding increases. And you'll see at the bottom, right, other data sources, including lived experience and local knowledge. So we are trying to keep up and make sure that we are using the latest language in science in the minimum elements. But as you can see, even in 2022, we saw HIA moving in this direction. And I'm going to, because we don't have a whole lot of time and I want to leave time for discussion, I'm only going to talk about screening and scoping. But remember, these are these phases of HIA. Just because you think you're done with screening, you might not be, right? You have to, as you get more information, it's like a funnel. You have to go back and look and make sure that your assumptions are holding that you made in screening and scoping, and make sure that you're, as you're learning new things about the community and talking with them, that you're expanding your ability to understand and to include their issues. So I'm just going to talk about screening and scoping today. We have some new tools for screening process. There are EJ indexes. Many of you are probably familiar with EJ Screen or Cal Enviro Screen or CDC's climate change vulnerability, or the SVI, the Social Vulnerability Index. We have all of these tools now, and we can, know a lot because there's all of these GIS layers that tell us, and a lot of these tools use an index to give you a score, a vulnerability score or an EJ score, which I don't find as useful as the descriptors, because what you're looking for are these baseline indicators of health, issues that the community has already brought up to you as a health issue, issues that you've looked at the literature review and have identified as possible health impacts of whatever the decision is. You've done your informal engagement, as I said, and you're using these tools to understand historical trends and concentration of burden. That is what these are great for, right? Prioritizing tools. You're able to see what some of the health effects are, and go to the community and say, which of these do you think are the most important? And then you can also use in the scoping process, you're also looking at key statutory and programmatic citing and resource issues. How much resource do you have to address deeper community engagement? Where do you draw the line? How do you define the boundaries of what is possible, so you're not creating false expectations in the community? And then you have to know, right, from those questions, are you going to be able to conduct a CIA, and is the juice going to be worth the squeeze? Because it's a lot of effort in making sure that you can still impact the decision. I mentioned some of these tools for screening that we use both in HIA and CIA, but in CIA, I think normally I use multiple of these tools, several of these tools. There are also some state by state tools. Colorado, New Jersey have their tools up. There's the CDC's Environmental Public Health Tracking Network. So there's all of these great databases, but you have to be able to pick and choose the things that are most useful to your community in the context in which you're doing the assessment. And these are kind of the questions that you ask in scoping in the regular HIA process. Who's impacted? Who's going to participate and when, right? Like, who are your stakeholders? What are the research questions and how are we going to approach them, right? Well, how we're going to talk to the community about them. And then how do we ensure that this is community centered? And then as you think about these questions and go to a deeper scoping method with CIA, right? You're doing some of the same things, But you're also able to use some of these matrices instead of just a single score like Cal Enviro Screen or EJ Screen give you. You can prioritize stressors. You can see which ones are the most prevalent or virulent, if you will, and take that back to the community in a visual form, which is a lot easier for people to talk about. And then this is also where you might want to do a mini racial equity impact assessment by doing a quantitative analysis of who benefits and who suffers, and then tie that back to the literature that review that you would do in HIA. And having these community engagements early in the process, whether that's doing a visioning session with them, having focus groups, listening sessions. I've been recently using photo voice with community youth, where you say, what are the things in your community that make it healthy or unhealthy? And they go take pictures. And that's a very powerful tool for understanding what people are worried about in the community, because that's just as important as what our empirical data is telling us. And then in scoping, right, we're really looking to formulate what's the problem, develop our research questions, identify what data is available, what do we need to collect, um, figure out what is our community engagement plan and how do we do that deep engagement? What are the boundaries, right? Is it, are we looking, in CIA, we look back at structural factors. Well, how far back do you go, right? That's a real question to determine what people's current vulnerability are. And what are the key stressors and how do they impact vulnerability? If you're looking at economic stress, right, there's mental health impacts, which have physical impacts. So, what are you looking for? And what does the community think is important in those key stressors and impacts? And then really thinking about the kinds of tools that are available to you for this deeper kind of scoping, whether you want to do a community charrette, which I find really useful because you can use visual tools and people can write on maps. And then come back together and talk about it. You can do small focus groups or interviews with residents. You can use communication tools like a pathway diagram to really get in deep with people and find out what are the stressors that are already impacting them. How do we get here? Right, that's the retrospective piece of it. Are there still policies that are persisting that impact or amplify people's vulnerability? And I'm thinking about things like the zoning map or allowable unwanted land uses that are being expanded nearby, right? What are those stressors? And then finding out from the residents, what are the things that they're worried about? Is it their kids? Is it some place for them to play? Is it their safety, right? What are those factors that as people who don't live there, we might not think about? So in an HIA process, you would use a pathway diagram, right? You would make this pathway diagram, you take it to the community, and you'd say, this is how we think this is going to work, right? There's going to be this new, I'm just picking on power plants today. There's this new power plant expansion pad that's being up for permitting. And how does that get to impacting us, right? And so you go through step by step what it looks like until you get down to the nitty gritty, right? Because there's positive and there's negative, right? There's more jobs, there's more economic opportunity for people, but there also might need to be some mitigation of the additional pollution. This is an example that I stole from the US EPA. I want to give credit to Sala for this one, but I took this one from her slides where you're really thinking in this bigger terms of what the new large recycling facility, right, with an auto shredder. Oh, I think this is actually from the Chicago one. I'm sorry. Um, yeah, this is General Iron, right? So more air emissions. And so you're really looking back at not just what's going to happen in the short term, but you go all the way out to long term and where are you going to be? And how can you adjust for the impacts? And this is what it looks like usually whenever you're, oops, sorry, whenever you're thinking about predicting health impacts in regular HIA practice, right? We have these questions that we answer and we kind of go through this process and stitch it all together. Whenever you're looking at CIA, you're really adding factors, right? Assessing structural and historical impacts, looking at historical policies, ensuring that lived experience is gathered and weighted in every section, every part of the process, right? Making sure that people's lived experience, their testimony is included and weighted with the empirical evidence and not just as a confirmation bias of, see, the empirical evidence said that, and that's what the community said, we're done, right? But there are challenges, right, to getting CIA implemented, even if we're calling it HIA 2.0. So just thinking about, how this would work, how to integrate it in regulatory policy, right? I know that the EPA has done a lot of thinking about this, and I know that there are a lot of people on from EPA. So I really want to also invite your comments. Tell me I'm wrong, because this is all in the thinking space right now, right? Like, how do we do this? What's a standard practice? How do we get to the point where we can talk about this as a natural thing? And honestly, not just as an EJ thing, right? When I was working at the health department in Florida, we were told we couldn't say climate change. So we talked about heat stress and we talked about people drowning and we talked about their wells not working, right? You talk about the health impacts. Because if we talk about this as just environmental justice, we're going to fail communities because people will shut down and stop listening. And what we have to talk about is how this process is putting people back into the equation, not just their lived experience, but the results and the impacts on them. Because I don't think there's any person who works at a regulatory agency that doesn't care about people and doesn't go to their job because they want people to be healthier and safer. So I'm going to leave some space for conversation, and then I'll reshare once we're done with my final couple of slides. Stop sharing. How about that? All right. So, I see some comments based on my previous questions. But I'd really like to know, right? So you heard my explanation and my hypothesis that CIA is really a deeper process of HIA. Thoughts, reactions, argue with me, tell me I'm wrong. Raquel?
Yeah, I wasn't going to tell you that you'd be wrong because that would be like I wouldn't be able to support that. I did have a question for you. When we are engaging with communities, many are quite done with people asking for their engagement. Any tricks or tips that you could offer to help, you know, really that co-learning process that you were talking about? You can only learn if the person or people who are learning want to engage in the process, right?
Yeah, and that goes primarily to that deep engagement that I was talking about. You can't just show up when there's a decision to be made, right? And this is the manpower personnel power problem, right? It's there should be someone from these regulatory agencies that regularly talks to the community-based organization, community leaders, and just, checks in with them once in a while. Hey, what's going on? Are there any issues that are happening in your community that I could be of assistance with? Because if they know who you are when you call, they'll mobilize their people, right? If you're authentically engaged and they know that you're sincere, which I think most people are, right? They want to do it. They want to do this engagement, but they just don't have time. But I think that building that network of trust with community-based organizations, with people who live in the community, even if it's like 3 people, then they can recruit others and create that coalition of the willing. But it's not a short process, right? It's just not. You can't just show up when there's something to be done and they say, "Oh, great, you guys are here to study us again." Right? I don't want any of that. Yeah. But you can also make it relevant to them. What I've found is even whenever people feel overstudied, if there's something that they believe they're going to get out of it, out of the process, if they feel like their voice is really going to be heard, or, they feel like they're really going to be listened to and have a part in co-creation, then that's more motivating, I think, than any kind of $10 gift card people give for participating. And I also think you need to pay people for engaging.
So maybe kind of start small so that you build that trust. And then when the time comes for something big, the trust has already been established.
Yeah, and I think that the idea of paying community people for their time and their participation should not is not a mild thing, right? I always tell folks if you're having a community meeting at night, right, provide transportation, have childcare, have food if you can, right? But that if people don't feel like they're going to be welcomed or listened to, they're not going to come. So I'm sorry, I'm probably beating the dead horse. Uh, let's see. Dr. Chu, do you want to come off of mute and ask your question?
Sure. Hi, Wei Chu, Texas A&M University. Um, thanks very much for this very interesting discussion. Dr. Dannenberg actually pointed this out to me in terms of joining. It seems that, and I'm not an expert in this area specifically, although I have worked on developing some screening tools like the Climate Vulnerability Index with the EDF. But I was wondering, in terms of the context of use of these types of tools, a lot of it seems to be more reactive. There's permit, there's a regulation, there's a policy. Any thoughts about moving to a more proactive stance? And that maybe gets at the question as well as to, communities are tired of being poked and prodded, but whether it can be used in a proactive way that maybe can provide, more positive direction.
I think it can be used in a proactive way. I think the issues are around resources, around training, around honestly, does the community, because to me that speaks to the community leading the process, right? Maybe with some guidance. But I think we need to build that capacity of communities to be able to do that. And we have to convince them that this is going to be effective, because there's nothing like working a year on an HIA and having the county commissioner pat you on the head and say thank you, right? And that's the end of it.
Yeah, I mean, one of the things we've done at A&M is working with our landscape architecture department and going and helping with master planning for communities, and as a way to sort of envision a better future kind of thing for these disadvantaged communities. And but these type of methodologies haven't really been, you know, implemented in that type of context. So I was wondering whether you or anyone else has any thoughts about that.
I'll open the floor up. Anyone before I answer? Anyone else have thoughts about that? About jumping into existing processes like comprehensive planning or small area planning, um, even economic or budgeting planning. I've always, I got my start doing this health in the built environment work as a land use planner in the state of Florida. And, you know, I came to it very early. Oh, well, we need to create health metrics for these plans, right? Planners are terrible at creating metrics for anything that we do. But because I come out of the environmental health tradition, I was like, well, why aren't we measuring this? Why aren't we analyzing whether this is working? Right? Whether that's actually promoting health just because you're building sidewalks, right? Can people use them? And so I think those kind of approaches are too incremental. I agree with you, they're proactive, but I think they're too incremental to make a difference immediately. I see Kathleen, I see your hand.
Hi, thank you. I'm Kathleen Schuler. I'm with Health Professionals for Healthy Climate in Minnesota. And Minnesota passed a cumulative impacts law in 2023, and it's undergoing rulemaking right now. So we're one of the groups that are providing stakeholder input to the rulemaking process. And one of the challenges is the agency charged with rulemaking is the Pollution Control Agency. And the health department is not really so much involved. So as you're looking at it, basically is about a regulatory tool for air permits. So you can't issue an air permit if it will create more pollution in that particular community. But we have health disparities between BIPOC and white people in Minnesota, and we'd love to see actual health data to see if this will make a difference. It's going to be way down the road. Are you going to have fewer asthma emergency department visits and so forth, and the other health impacts? So that we have resources with one agency, but you also have the health department that should be involved in how they work together, and we're urging them to work together, but that's the challenge.
No, and it is a big challenge nationwide, and it has been for a while. I see Dr. Dannenberg is still with us. Andy, do you want to speak to the challenge of getting planners and health departments to talk to each other?
Yeah, there we go.
There you are.
I'm not sure what to add other than yes, it's a challenge. I think part of what we've worked on over years is just trying to get people in public health and people in urban planning to learn more about each other's worlds, get some people cross-trained, and have that awareness that each of them is impacting the other. But no easy way to get there.
No, and I think the regulatory professionals, right, they're a whole different set. They don't always work with planners, and in the case of Minnesota pollution control, I believe they're actually environmental scientists that are doing that work, right?
Yeah. Yes, definitely. There's scientists and an array of different skills. Yeah, thank you.
Yes, ma'am. Other thoughts or experiences? All right, Raquel?
As you all were talking, I was thinking that sometimes another problem is that some health endpoints are not really measured, and they may be relevant, or quality of life in some cases, and they may be relevant for more relevant than anything else for some communities. I remember an example that always comes to mind because it was so critical of a community where there was information on several health endpoints, but there wasn't information on people, unhoused people, and drug use by that group. And that was the aspect that the community was most concerned with. There were other things they were concerned with, say diabetes or other health endpoints, but that was the concern. And there wasn't data, but there was knowledge. So there wasn't like quantitative data, but there was knowledge in the community about the situation. And incorporating that knowledge, sometimes it's hard when people are more used to quantitative data.
And that's a shift I'm seeing in a lot of agencies where they are hiring social scientists more now. And I think this is part of the result of the Biden-Harris administration's initiatives. But I hope that that remains, right? I think that that perspective is really important, and we have to have both kinds of data, right? We have to know what the quantitative risk is to the extent that we can, and then we have to know not just the lived experience, but the social context in which these people live, right? Because that's how we're going to understand their vulnerability. We'll get there. Hey, Dr. Stephanie, I see your hand.
Hello, how are you?
Good to see you.
Nice to see you as well. I have a question that is perhaps an annoying one, but have you seen any scenarios where cumulative impact analyses have been defensible in court, or where there are opportunities within regulations to incorporate these types of analyses in either in permitting or in regulatory review?
There's currently a lawsuit in Louisiana that has not been resolved yet. As far as this being a defensible process, we will see. But the one cumulative impact assessment that I would say that was done already with an eye towards where this is going, what I was describing, was done by the Chicago Department of Public Health on this recycling facility. And they were moving it from an affluent white neighborhood down to a community that's experiencing a lot of environmental justice issues already. And the people mobilized, and they worked with the health department to do this CIA process, and the permit was denied. I mean, that's pretty powerful. Only, as far as I know right now, only New Jersey has a condition in their law that says the permit could be denied. The other state regulations, with the exception of Minnesota, which hasn't finished rulemaking, they all call for modifying the permit conditions. Right, so it's a little bit less teethy.
Yeah. Thank you.
Thank you, Lindsay, for putting that link in the chat. And I think I just answered Andy's question too, because that's really the one that that I consider well done, that really has used a cumulative impacts approach. Chicago is actually formalizing their process and using it for other things. And I saw Aaron put the denial letter. Thank you, Aaron, in the chat. You guys are on the chat. Other discussion? This has been really great. It's really helped me think this through, right? Because this isn't a set thing at all, right? It's still in development. It's still moving and evolving. So I just have a couple more slides that I want to share with you. Put this up. So this webinar, as I said, was co-sponsored by SOPHIA, and we will be having another webinar on December 11th at 2 p.m. Eastern, which is our slot for our monthly webinars. And it's really about our HIA selector tool. And I see Audrey from our steering committee who's here to do the pitch. She is the co-producer of this tool.
Thanks, Sandra. Yes, Audrey Berner from the Eau Claire City County Health Department, and also on the SOPHIA Steering Committee as secretary currently. This is actually a tool that, yes, I've been a part of, as well as the newly rebranded Equity in HIA and Health and All Policies Working Group. So as part of SOPHIA, not only do we have a steering committee in our structure, but we have several working groups that have some more tangible deliverables throughout the months and throughout the years that they take on based on their interests. And one of the interests in the the equity working group was to have a really tangible tool that people could use to help. When we talk about doing health and all policies, okay, what does that mean on a day-to-day basis? Or what does that mean for someone who's new to thinking about things that way? So we've developed a tool based on some past research that we'll be showcasing next month. It's interactive, it's fun, it's a different way to think about applying health and all policies to your community and to your work. And as part of this webinar, we will also be splitting the time with our friends from NACCHO and ASTO, who have recently launched their Health and All Policies evaluation tool. So it's kind of a twofer, a little bit about how to do health and all policies tactically, and then a little bit about how to evaluate the work that you've done. So I just dropped in a link in the chat, SOPHIA events. That's where the registration link is for next month's webinar. And with that, I think I can hand it back to you, Sandra.
Thanks, Audrey. I'm really looking forward to this webinar. And if you have enjoyed this conversation and you want to continue talking about this, you can contact me directly, and that's my email. I want to thank you all for coming today. I really appreciated this conversation and the opportunity to engage with you about this. SOPHIA has monthly webinars, so please check out the events page that Audrey posted, and I look forward to seeing all of you soon. Thank you.